The Suicide Crisis Line says it's dealing with a spike in calls after it switched to a much simpler phone number. Now federal lawmakers are pushing for more support.
As NECN's Dustin Vladkowski shows us, they're trying to get the word out about what could be a life-saving resource.
The experts tell us that it is indeed due to the change into a three-digit number.
Maine Republican Senator Susan Collins is one of the federal lawmakers saying more resources need to be put toward the National Suicide and Crisis Lifeline. In July, it changed from a 10-digit number to just 3 digits, 988. The senator's office announcing Wednesday that government data now shows many more calls are coming into that line. They're up 45% in August 2022 after the change from where they were in August 2021 before it happened.
I do think it's attributable to changing to 988. We need to assess whether our efforts to reach people who are in the midst of a mental health crisis are successful or not. Is there more that we can do?
To that point, Collins also saying Wednesday she and Senator Tammy Baldwin, a Wisconsin Democrat, want Congress to look at a proposal they've created they say would strengthen the lifeline. Part of it would put $10 million a year in funding for the next 5 years towards 988 to make sure the line is available 24 hours a day, 7 days a week. Other parts would create more oversight to get a handle on whether or not as many people as possible who need its support know what 988 is and how to access it.
A lack of knowledge about it needs to be addressed through a public service ad campaign. We want to help connect people to the help that they may need when they're experiencing a crisis in their lives.
Because of Congress's calendar for the remainder of this year, this likely wouldn't be acted on until much later in 2022 or in 2023. Collins acknowledging Wednesday that there are also ways mental health needs to be addressed in America, including what she says is a shortage of mental health professionals nationwide that's especially acute in places like Maine. Help, she says, is needed to confront challenges that are here now.
We're also seeing a real increase in families needing mental health and emotional support for their children and for themselves.
In Portland, Dustin Vladkowski, NECN.